Hi, in this video, I'm going to be talking about the impact of socioeconomic position on breast cancer. Socioeconomic position, what is it? It's where you stand in society in terms of power and access to wealth. So, socioeconomic status or position, which we measure as income or wealth, which means particular things that you own, not just how much money you're bringing in. And also, it depends on the people around you. And wealth reflects power. So when we're talking about breast cancer and all cancers, really, people who are in a worse socioeconomic position relative to those around them have worse outcomes. This is for a few different reasons. The first is the biology of the tumor. So tumors in people who face more discrimination, who have to struggle more, those tumors tend to be more quickly growing. It's this weathering hypothesis that the more you're fighting just to put food on the table and to navigate a complicated system puts more stress on the body. And so it's called allostatic load in the medical literature, or weathering in social sciences, just the wear and tear on your body. And people who have more wear and tear are more likely to have faster growing tumors that even if regular mammograms are performed, those tumors can grow between mammograms. And as I mentioned, this is not just the case for breast cancer, but for other cancers as well. The next way in which socioeconomic position is related to breast cancer and its outcome is difficulty in getting screened. So this talk about getting your mammogram once a year is really not that simple for people who don't have insurance. It's not that simple for people who can't get time off from work without getting an unpaid up to 3 hours for travel time. It's really not that simple if you have children and need child care. It's not that simple if you live in a rural area. So we think, insurance covers mammograms, it shouldn't be a problem. So not only are there people who aren't insured, but even when you have insurance, getting a mammogram is really difficult. For those with insurance, there are no co-pays for a mammogram, but insurance won't necessarily cover follow-up mammograms like diagnostic mammograms or additional testing that needs to be done without a substantial copay or high deductible, which is really hard if you're somebody who's on the sort of lower social stratum. We like to think that everybody has the same chances to get good care, but it's not the case. The other way in which socioeconomic position can impact outcome is via treatment. So people who cannot get access to treatment, again, because they can't take time off work, or they have problems with childcare, or their out-of-pocket costs are so high, this impairs their ability to get timely treatment, quickly and well coordinated, and it can impair the ability to get high quality treatment. In some work that I published quite a while ago, I showed that people with lower levels of education attainment, my team and I showed that people with lower levels of education were more likely to have their chemotherapy reduced. And this may be what's called misguided benevolence on the part of the medical team, seeing the stressors on this patient, wanting to give lower doses in hopes of making chemotherapy more tolerable, when really the misguided part is you need full doses of chemotherapy, especially in the curative setting, to get the benefit of chemotherapy. It's also hard to get daily radiation if you're somebody who can't take time off work or you have problems with transportation, and that's related to where you live and also to segregation of neighborhoods. How does socioeconomic position overlap with other things we know impact outcome? Well, it is a matter of fact that minoritized populations often have less socioeconomic position. People who are in segregated neighborhoods that have less wealth have their education dollars decreased relative to a wealthy neighborhood. So if we think about education, health literacy, the ability to ask for and get what you need is much diminished. And we know that populations are segregated in many cities. It's harder to measure segregation in rural areas, but we know that there's a great deal of rural poverty. And we know that a lot of people who are Hispanic and a lot of people who are Native live in rural communities where it's harder to access care. It's really complicated. We call this intersectionality, where you have multiple layers of disadvantage. So I'm not going to be all doom and gloom. There are a lot of things that have been done that have been highly effective. Mobile mammography, for example, has, in many studies, shown that Black women are as likely or more likely to have screening mammograms. So for people who live in an area that has mobile mammography units, this is one way that's been highly effective in decreasing disparities according to socioeconomic position, ability to get to a mammogram, ability to get time off, etc. There's other work being done with tribal populations using mobile mammography as well. The other thing that's really been helpful is expansion of Medicaid, so that people who would not have qualified for Medicaid have had the opportunity to qualify for Medicaid in states that have chosen to expand Medicaid. We also know that there's healthcare reform that's trying to support practices that deliver good care, not just to their individual patients, but to the community. These are the kinds of things it's going to take to advance healthcare equity, not just in breast cancer, but across all diseases, preventive care, etc. If you live in a state that doesn't have Medicaid expansion, you get to vote. So you can vote for Medicaid expansion so we live in a more equitable society. I've covered a lot today. If you're wondering what kind of treatments are going to be part of your treatment plan, visit yerbba.com. We actually offer the service without a cost for people who qualify. And if you like this video, if it was helpful, interesting, click like, subscribe, share it with a friend, and as always, drop a comment below and we'll get back to you as soon as possible.